not a broad sea change, mind you, okay, but gradually consumers, those who would seek information online, are beginning to gravitate towards the internet, towards resources outside of their current care pathways for information. We're slowly shifting from a monodirectional pathway where you're going to a static website for information to a really bi-directional exchange where not only are you going to the website, but you're also leaving a little bit of yourself there, providing information, interacting with a group or a forum, and really pulling information, but as well, and contributing as well. Okay. Incidentally, when I was an undergraduate, one of my first jobs was to really study the emergence of websites tailored to specific needs. And I had a little tally, a little spreadsheet that really calculated how many websites we were seeing in the healthcare space. We got up to 100 or 200 or so, and I thought, wow, this is incredible. Such a high number of websites dedicated to healthcare. Where is this going to go? And then, 5 years later, we were up to 10 or 15,000 reported in some spaces. Now I'll submit to you that the question shouldn't be how many websites we've actually reached with regards to healthcare, but is that even the proper methodology to be using to be studying how folks go online to think about obtaining information to drive their care decisions. We're moving from a world where that was previously driven by static content, managed by information providers, either professional or amateur, to a more Web 2.0 atmosphere. As Alice pointed out, blogs, wikis, forums, and groups discussions at an extraordinary level, okay, where it's not only static content, but video. Not only information that's dated, but real-time, where you're dealing with tweets or real-time monitoring of statistics. Okay, sharing tools within larger communities are really driving some of these developments, and it becomes a situation where you might be on a site, and a portion of it is dedicated to your own specific healthcare, and you don't realize that at any given time. That is making its way into devices. That is making its way into the care practice setting at a very slow pace, okay? But it is making its way into the general consciousness where your conception of what is a healthcare site, what is consumer information, is slowly evolving. So I'll urge you to kind of keep that in mind. Technical and cultural development plays a significant role into this. Think about how much of your daily life is managed by yourself in terms of information. You can go online to manage your travel. You can create budgets for yourself, to take care of your finances online. But the world of healthcare is still very much disaggregated. Okay, we're trying to find a world to reconcile two different worlds here: an online 24/7 world filled with more and more people constantly adding new information to the mix, but also trying to extract personal information that can help you manage your care. We still turn to trusted sources for a good deal of that information, but a larger and larger percentage of that is generated through these dark pools of information that we can't actively project or where they're going to go. You're in an environment now where social networking and other tools allow one to dive very deeply into the management of one's health. If you were to be prescribed a new medication today, that very same afternoon, you could find 1,000 other people online who are taking the same medication, who have very different treatment regimens, but you are able to draw trends and analyses that can be, interpreted to your own care without the aid of a physician. Okay, and that probably gives a large number of folks in this room pause, but that is something that is actively happening today, and really the genie is out of the bottle in terms of trying to, actively direct individuals on where to go. If someone were to ask me today, what is the largest healthcare website or application currently online, you could probably make a strong argument that that would be Facebook. Trying to connect with a whole host of other individuals along very discrete, very narrow pathways is something that social networking is designed for, and that certainly will have implications for how we develop policy around health information, and especially around security and privacy issues. So the world is, I guess, rapidly changing with regards to the social media, okay, and we need to be cognizant of the cultural changes that are taking place, first at the margins, but eventually making its way into the mainstream. I'll read now a quote from Charles Safran, the president of the American Medical Informatics Association, via congressional testimony, where he states, "In our country, patients are the most underutilized resource. They have the most at stake. They want to be involved, and they can be involved. Their participation will lead to better medical outcomes at lower costs with dramatically higher patient and customer satisfaction." And I think that's a statement to be considered very carefully, because as this very large, ambiguous group of individuals begins to coalesce, how will they influence the direction of their care when you are when you're moving from a very structured model, okay, where you had very clear lines of communication, clear lines of trust and authority, suddenly moving to a very disaggregated model, and having that be the driver is something to consider, not only for clinical data, but for these other pools of data as well. Okay, I offer up a little image here. Okay, so at first this cartoon gave me a little bit of a chuckle, right? That wow, that's pretty interesting. But I'll submit to you that as our information networks become more robust, okay, as we're able to get higher throughput and the amount of information transfer becomes a magnitude of where we are today, video is going to play an increasing larger and larger part in our lives, where not only can we text, email, okay, and communicate via standard fields, okay, we can also begin to have real-time conversations, and you're already beginning to see some of that through the newer mobile devices that are just beginning to become available to small segments of the audience. What implications will this have on rural health? How will this, affect areas of healthcare where access has been traditionally the largest barrier? Not only access from a geographic standpoint, but access to information, access to expertise, okay? And you're going to see new, models of care beginning to develop, and models of care delivery beginning to be instantiated or at least experimented on. Right now, in this day and age, you can purchase concierge services that make significant use of video technology, okay? And we're going to see a significantly higher, permeation of these technologies in the near future. Now, mind you, I'm not making a comment on the viability of these technologies or whether they should be embraced or not, but the innovators are currently thinking about these and trying to experiment, pilot, obtain proof of concept via these, and their proliferation should be monitored closely, because it is their success that will have profound implications on the care delivery tomorrow. A little bit on mobile health, okay? It's an area that we're studying very closely at the department, both within the ONC, but also across a number of other agencies. The Department of Health and Human Services first launched its first national mobile health project earlier this year called Text for Baby. Not a very sophisticated project technically, but one that had a very rapid and high level of adoption. Basically, the Text for Baby program is one where expectant mothers can sign up for a service where they receive text messages 2 to 3 times a week in the weeks or months up to delivery. Okay, so a very clear way of providing messages, the right information at the right time, as you pointed out, Alice. Okay, to individuals. 4 billion mobile phone users in the space. That's an approximation, of course. Okay, but with smartphones being the fastest growing segment of that group, what happens when the information that you need to induce or promote change, personal change in your behavior that will lead to better health outcomes becomes instantly available? Is that a technology that will be sufficient to overcome the engagement issue that I talked about earlier? Okay, or will it be just a fanciful idea that's only embraced by a niche population? The Text for Baby program within a few months had over 100,000 subscribers. Okay, and the department is currently focused on not only follow-ons but a clear evaluation of what that project achieved in terms of clinical outcomes. So it's a wait-and-see attitude. I think that looking at some of the research projects that are being funded through NIH, we're just beginning to scrape the surface of functionality with regards to mobile health. I'm talking about not only the opportunity for data capture and bidirectional communication, but utilizing GPS technology, utilizing cameras, voice recognition, and augmented reality. Just as a side note, I was fortunate enough to see a beta program the other day where you put a mobile phone over a piece of text, and instantly it translates that text into the language of your choice. Okay, and that's just a nifty example of how these little personal computers that we're carrying around every day, always at our side. I don't know if you're anything like me, you have it. You have it when you wake up, you have it when you go to sleep, and it's always by your side, and it's a little frightening about how closely integrated within your lives these devices become. They are becoming ubiquitous, and thus a potential pathway for, I guess, collecting, transmitting, and analyzing information relative to your personal health. The engagement challenge still remains. Okay, while I paint a very rosy picture in the first part of my presentation about the technologies that are proliferating, we still see a significant challenge with what the average consumer, the average user does with this technology. Sometimes we see drop-off rates of about a half-life about 50% every 6 months or so. So a website that is very new and shiny and brings together a lot of information. Okay, eventually the patients, consumers begin to taper off because it's not as compelling as it could be. Okay, we are beginning to see some I guess channels that are able to keep up longer engagement timelines, but this is an area that we still need to be very cognizant of as one that represents a barrier to adoption. Okay, being able to change behavior, induce behavior to some within a large population is very difficult. Some new I guess methods for using these technologies to encourage higher levels of engagement, gaming, peer pressure, using financial carrots, and having ubiquitous reminders has helped to kind of bridge that chasm, but we're still a long way off from any, I guess, single silver bullet solving, I guess, consumer technology-driven care. So really, what is driving a lot of this innovation that's taking place? I mean, is this just a trend that has been ongoing over the last 10 years? And I'll submit to you that there have been a few, I guess, notable and recent developments that have taken place, which have encouraged a high level of innovation.